Hello, welcome to another great episode of Royal Black and Elite. I'm Lady Trinette Wilson, your lecturer and social historian. I want to thank everybody who tuned in for the first episode of Hunter's Point. That's my all new historical audiobook, and it's a drama. It is fantastic. Listen, I've left some links down below for you to look at episode one. And again, everybody, thank you. October is a very special month, not only because it's my year anniversary, but this month is Breast Cancer Awareness Month. And I want to recognize Dr. Jane Cooke Wright, who is an innovator in the field of chemotherapy and breast cancer treatment, and she's known as the Mother of Chemotherapy. She was absolutely brilliant. She lived to almost 94 years old, and I do believe she is one of the ones who are royal, black, and elite. Now, I want to give you a little bit of history on the treatment of breast cancer. Breast cancer has been around be, before Christ, like 460 BC, and there were surgery back then for it. So breast cancer has been around for a long, long time. By the 19th century, a doctor named William Halsted, he developed a radical mastectomy, and this was about 1882, to remove the entire breast. In 1928, they started doing some hormonal therapy. And by the 1930s, they began to introduce the development of radiation therapy, chemotherapy, and adjunctive surgeries, which would remove the cancer that was around the breast. So it was pretty primitive the way that women were treated back then. And Black women who really had even less access to doctors were even diagnosed even later and experienced more pain, experienced more, terrible treatment, deformation because of the removal of the breast. And let me tell you all, they were doing this stuff no matter if you were black or white with no anesthetic. They were cutting off these ladies' breasts. So we thank God for Dr. Jane Cooke Wright and her work in the field of breast cancer treatment. Women, all women, don't forget to get your mammograms every year. And I want to pay respect to the women who've lost their lives in the breast cancer battle or any kind of cancer battle. Now, and let me also say for my mother as well. So Jane Cooke Wright was born on November the 30th, 1919 in New York City. And the family was already making history. Her dad, he was a Dr. T. Wright. He was the first African American graduate of Harvard Medical School and the first Black doctor appointed to the staff position in New York City Hospital. So he was a surgeon, a scholar, and he believed in racial equity. Her mother's name was Corinne, and she was a school teacher, an educator, and she was as you can see, an Anglo woman. So this is her parents. She grew up in Harlem though, and she grew up during the Harlem Renaissance. And her father was very dedicated and engaged within the Black community. He wanted to use his medicine, his research to help Black people who often were disparaged when it comes to the medical field. And as you see here, she's a beautiful girl. Jane's actually she graduated at the top of her class from Smith College in 1942. And then she earned her medical degree from New York Medical College in 1945. After completing her internship at Bellevue Hospital and her residency at Harlem Hospital, Dr. Wright joined her father at the Harlem Hospital Cancer Research Foundation, where they began a revolutionary quest, which was to find better ways to fight cancer. What a legacy to leave behind for your child. That when she graduated high school, her father was at a position that he could allow her to come and work with him in his field. So that's a blessing. We should position all of ourselves to be able to give our children a leg up like everybody else does. So I think this is really beautiful. Now, at the time, chemotherapy was still new. It was risky, and it was actually often, it took the people's lives who did it. Many doctors doubted if it could really cure cancer. But Jane and her father, they kept working and they believed otherwise. Together, they began experimenting with different chemical agents that could target and kill the cancer cells without destroying the healthy ones. So this is just so beautiful. Now, I want to say that she did get married to David D. Jones. They had two children, Jane and Allison, and they actually were also in the medical field. Unfortunately, however, her husband did pass away in 1976 of heart failure. Now, when her father passed in 1952, so let's back up, she was only 33 years old, and she actually took over as the director of cancer research of the Cancer Research Foundation. And she continued his work, but she expanded it. Dr. Wright developed innovative methods to test how drugs affected cancer cells outside of the body using tissue cultures. This breakthrough allowed doctors to study cancer more safely and effectively, paving the way for personalized treatments, something that you said was not, available back then. Everybody got the same treatment. They all got their breasts cut off. So because of her, they began to develop a treatment for each individual person, and that's what they do in modern oncology today. She was also among the first to use a drug called methotrexate. That's a chemotherapy drug that would later become a cornerstone. Y'all, did you hear what I said? A cornerstone in treating breast cancer, leukemia, and other cancers. Her research didn't stop in the lab. She traveled also across the world. She collaborated with other scientists and she helped establish chemotherapy programs in hospitals all across the world. Now, in 1967, she became professor of surgery and associate dean at New York Medical College, making her the highest ranking Black woman at any U.S. medical institution at the time. I tell you, she is a true trailblazer and worthy of a Royal Black and Elite lecture. Around breast cancer, among Black women, it is very aggressive. Women are also passing away at earlier ages because of later diagnosis because they're getting breast cancer at 33, where you're not going to get a mammogram till you're about your 40s. So, ladies, know your bodies. Do breast exams. If anything changes, if you see any discharge coming out, your nipples, you've got to take care of yourself and make sure that you stay on top of this. And now, seeing a Black woman being the highest ranking woman in any U.S. medical institution during a time back in the early 1900s and in the 1960s, it brings us pride to know that she understood how important it was for us to take care of our breast health. So during this Breast Cancer Awareness Month, I hope that you are taking care of yourself and that you're getting the treatment, you're getting the test that you need early and paying attention to your body. Now, if you've lost a loved one like I have to cancer, definitely put a heart down below so that we can recognize your loved one. Now, Dr. Jane's achievements were widely recognized. She served as the national president of the New York Cancer Society and was appointed to the National Cancer Advisory Board by President Lyndon B. Johnson. And she received numerous honorary degrees and awards throughout her career. Now, she retired in 1987, so not really that long ago. And when she retired, y'all listen to what she did when she retired. She sailed, she did watercoloring, and she read mysteries. Some of us, we need to take lessons from that to learn how to relax once you've had a wonderful, long, and rewarding career. So thank you so much for what you have done, the work that you have put forward, Dr. Wright. And if it weren't for you, women would not be receiving this seamless chemotherapy that we see them receiving today. Now, Dr. Wright passed away on February the 19th, 2013, after an illustrious career at 93 years old. So thank you, Dr. Wright, for your innovation and your work in the field of medicine. If it were not for you, we would not be where we are. I want to thank you all for joining me. Now, as you know, my lectures are for educational and entertainment purposes only, and the Fair Act use is in effect. Now, click them down below. Continue to learn. I've got some great other lessons also about other women in the medical field. Now, I want to thank you for joining me for another great episode of Royal Black and Elite. And don't forget, hit that like, share, and subscribe, and you all turn on your notifications. And they've got this new hype button. Make sure you hype the video so more people can learn about this great doctor, Dr. Jane Cooke Wright. Have a wonderful day, and I'll see you on another great episode of Royal Black and Elite. Like, share, and subscribe. Click down below, and thank you.